Good morning again to the Endovascular TV. Now we have the pleasure to interview Dr. Jacques Busquet, past president of the ISES and vascular surgeon in Paris, France. Nice to have you here.
Nice to meet you.
Where are we going with the endovascular surgery, endovascular therapy? Which are the future steps we have to do?
Before speaking of the future, I would like to speak of the history. And this technique started in the late 80s. And we were a group of pioneers to adopt this technique for our vascular patients. Vincent Terriambo from Barcelona was one of these. And I was happy to be also involved. And we moved during the 10 years on all this new technology. Now we enter a period of maturity. Maturity regarding the catheter, the balloon, the stent, but also the result of the trials and the result of the currently available technique. So the future, to answer your question, is probably very fruitful, and I know that some team and some countries are working on some innovation, so it's an hopeful future for our endovascular technology.
And in 10 years, we will still have stents and balloons, or we will move forward to different things?
I think we will keep the basic technique, and we know from now that balloon and stent are here to stay, but they will probably be updated and upgraded with a lower profile, for instance, better adaptability to the anatomical situation, but also, and maybe the most important, drug-coated balloon and drug-coated stent with new drugs. So we will probably enter in a new era of pharmacologic use of this stent and balloon.
Here we have the pleasure to interview a very well-known endovascular specialist, but this is true that there are some factors difficulting the spread of endovascular therapies in some groups. Maybe the price, maybe the skill difficulties, learning how to perform it. What can we do to spread these techniques, or we should not spread these techniques?
Our world is not ideal. For instance, and at the beginning, we had some tough battle between specialty, radiology, surgery, cardiology, to know who was allowed to work on the peripheral arteries. Now, there is a sort of consensus, and there is a big collaboration between specialty, and it's one of the aim of the ISES that I represented today. Second, we have a sort of difficulty in terms of access to the technique regarding certain countries. But Western European countries like Spain, like France, are not considered as a problem. So finally, the pricing, technology in the medicine are very expensive.
Sure.
And we have to try to keep in mind the cost effectiveness of each of our procedure. But globally, when you have an efficient social security, reimbursing the products that we use in our Western European countries, I think we have some recommendation from the national agency So I think we are doing a good job, and keeping in mind that we must be serious and try to keep into the limit of effective cost.
You said we should collaborate with radiologists. Should vascular surgeons work with radiologists or fight against radiologists?
No, this was 10 years ago or 15 years ago when the technology just started and emerged. Now, inside an hospital, for instance, it's what I've seen. The people try to work together. Most of them have medical staff together. And in fact, we must use the skills of each specialty to accomplish a sort of ideal collaboration in the name of the patient.
Yeah, that's the issue, patient. Changing the topic and talking about meetings, about congresses, what do you think, which kind of meeting or symposium should be the future? Should we have so many symposiums and meetings in every country, every small little meetings, or should we move to a more globalized symposiums? Which is the best?
Dr. Mestre, since the technology have spread worldwide, we assist to a multiplicity of congress, I admit that. Maybe there are too many, but each of them have their value and represent something. The format is something to discuss. You have a big meeting with 3 or 4 day meeting, gathering a large faculty and with place for discussion. But you have also something which could be the future, the one-day meeting. Only one day devoted to a certain title, a topic, with a high-level speaker, and probably the industry which usually supports that kind of congress will be more helpful and could help this type of smaller meeting, but maybe more informative.
So we should move to high-level, short and precise meetings.
What I think.
Great. Just to finish the interview, you know, we are starting with the Endovascular TV channel, which is something new and very promising. What do you think about it, this initial idea? Do you think it's a good idea? Do you think it's worthless?
I'm very happy to be interviewed by yourself and to discover your very nice channel. I've been involved in the past in such a project in US. So you are bringing to your patient and your colleague something new. We are living a world of information, a world of computing, so you are in a good path. And I hope that we can discuss into a sort of a forum, international forum, coming directly from your very good idea.
Merci. It was a real pleasure to have you here. Thank you very much.
Thank you, Dr. Mestre.
See you. Follow us on Endovascular TV. Thank you.